Good evening this Sunday. Welcome to your health show. My name is Purity Museo. According to the World Health Organization, pneumonia accounts for 15% of all deaths of children under the age of 5, killing over 800,000 children in 2017. Pneumonia caused by bacteria can be treated with antibiotics, but only a third of children with pneumonia receive the antibiotics they need. World Pneumonia Day is marked every November 12, and this year's theme is Stop Pneumonia, Every Breath Counts. What is the difference between cold flu pneumonia and sometimes we even hear of double pneumonia? The focus of today's show is pneumonia. We have an expert who will unpack all you need to know about this disease. Prof.Grace Irimu, a child health specialist and a health system researcher, Department of Pediatrics and Child Health at the University of Nairobi. Thank you so much for joining us and welcome to this program.
Yeah, thank you very much, Purity.
Yeah, it's exciting to talk about pneumonia at a time when we are facing a pandemic, and some of these symptoms of pneumonia, you know, they are similar to those of the COVID-19 pandemic. And now the world is marking Pneumonia Day with a lot of concern, especially in pneumonia among the children. Okay, so maybe we can begin by talking about what pneumonia is and what causes it.
Yeah, thank you very much, Purity. So pneumonia is an infection of the lungs, and this infection can present in different ways, depending on the severity of the illness. But the primary thing is that the children who have pneumonia, they have cough or difficult breathing. And then they have other added symptoms and clinical signs that help us grade the severity of pneumonia. So for a child who has cough or difficult breathing and has fast breathing, is breathing faster than usual, and most mothers can actually tell. They can tell. In fact, mothers' perception of fast breathing is actually quite good. It's quite accurate. It reflects that there's an increased rate of breathing. So a child who has increased rate of breathing and a child who has lower chest wall injury, you know, you find as the child breathes in, the lower rib cage moves in. So a child who has increased rate of breathing has got lower chest wall injury, that child has pneumonia if the child has cough or difficult breathing. Right. But then we have other signs which occur in children who have severe pneumonia. For example, a child might not be alert. You know, you're talking to a child, the child cannot make eye contact. Sometimes they can even be in coma, you know, depending on how severe the pneumonia is. Then a child could also be grunting. Different people have got different ways they use the language they use. For example, in my language, we say Oshaya, and other people have got different ways of expressing that. Grunting is, yeah, and that is a very sick child. The other one is just a child who is unable to eat, a child who is unable to drink. A child who is unable to drink is a very sick child. Unfortunately, sometimes even when these children come to us and they're not able to drink, we tell the mother, yeah, give something. But if a child is very sick, cannot feed, you know, and that's a sign of severe pneumonia. So the signs of severe pneumonia, we have said, are where the child is unable to drink, a child who is not alert, a child, you know, is not making eye contact, a child who is grunting, and a child whose lips look dark, a child who has cyanosis, is not getting enough oxygen in the blood. And better still, we can measure that using a pulse oximeter. Now everybody, I think, knows pulse oximeter because of COVID, where you find the oxygen saturation is below 90% in the severe disease. So what we have said is fast breathing is the key sign that a child has got pneumonia.
Okay. We can start by talking about the functioning of the lungs so that people may understand how important the lung is in the body.
Yeah, thank you. Every cell in the body requires oxygen. And we get that oxygen from the atmospheric air. You know, as we breathe now, we are breathing 21% oxygen in the room air. So that oxygen, when one breathes in, it goes to the lungs, where the air goes to the lungs, where oxygen diffuses to the blood from the lungs, and then is transported to the cells. And now at the cell level, there's a lot of things going on within each cell, the cell metabolism. And we have carbon dioxide being released from the cells. So that carbon dioxide is transported through the blood and to the lungs, where it again diffuses out from the blood to the lungs and is exhaled out. So the lungs are important as a gas exchange organ, where we are exchanging carbon dioxide and oxygen, and this oxygen is very important for survival. Now, this is possible because in the lungs we've got small sacs, very many sacs of which we call alveoli, and these sacs, they increase the surface area through which that gaseous exchange is going to take place. Now, these sacs are filled with air. But in a child who has pneumonia, the sacs are filled with fluid or pus. So gaseous exchange then becomes a problem. And therefore, these children get problems in getting the oxygen. So
there is a problem with the gaseous exchange.
Yes.
And what does this mean if the lungs are not functional because maybe it's been attacked by pneumonia? Let's talk about the importance of ensuring that there is efficient exchange of the oxygen and carbon dioxide that is exhaled from the body.
Yeah, thank you. So when a child has pneumonia, those small bags I've talked of, the very many alveoli, they are filled with fluid or pus. So they're not able to exchange to act as the organ of gaseous exchange. So you find that in such cases, then the children have got, they are not able to get enough oxygen from the lungs. The other thing I would like to mention is the other muscles which help in breathing, and we have the diaphragm. The diaphragm is attached to the lower rib cage, and the diaphragm is dome-shaped with the dome pointing to the head, you know. And what happens is that when one is breathing in, the diaphragm contracts and it moves down. Now it was dome-shaped. It moves down to the abdomen, and therefore it increases the volume of the lungs. When there's increase in volume of the lungs, then it means we have decreased pressure. So the air now can actually be able to move in. When one is breathing out, is usually a passive action. So the diaphragm now becomes dome-shaped, and so the volume of the lungs decrease. With decreased volume of the lungs, there is increased pressure, and therefore we can force the air out.
That's now the deoxygenated air.
Yes, that's the mechanism of breathing in and out. Now, with a diseased lung, that diaphragm really works very hard, and so we have indrawing of the lower rib cage, which is an important sign for pneumonia.
How is pneumonia transmitted? Maybe you can explain that concept.
Pneumonia is transmitted by droplets or by also direct contact. So when somebody who has the pneumonia coughs, and remember that these bugs could be in somebody who doesn't have a disease. And the person who gets the disease, sometimes they get this disease because of the immunity of the body. Children have got low immunity because of their maturity. And then we also have other people who have got low maturity or low immunity. That's for example, HIV infected children. So they are prone to get pneumonia. So we get the pneumonia because of the virus or the bacteria or the fungus going to the lungs, through from an infected person through droplet, through, you know, as a person coughs, as a person coughs or sneezes.
And why is it prevalent or most common during the cold season, and it's being transmitted through droplets?
So the cold itself creates environment which is conducive with transmission of pneumonia.
Yes.
But for some children who have allergy, who have hyperactive airway disease, so they'll cough because of the cold. Yeah, they may not have pneumonia, but they'll cough because of the cold.
That means not every cough is pneumonia.
Not every cough is pneumonia.
Pneumonia is also prevalent in South Asia and Sub-Saharan Africa. Maybe why is this so?
Pneumonia is actually a disease of poverty and is in areas where there are multiple deprivation. And so in those areas, you find that is where the rates of not breastfeeding, exclusive breastfeeding, are high. Malnutrition is also high. Overcrowding is also high. Indoor pollution is also high. And then the access to health facilities, so they don't get timely treatment for pneumonia. So all those factors combined together, they actually make these low-income countries not a good place when it comes to pneumonia. And
there are antibiotics that are used to treat pneumonia, but still the statistics of the number of children dying from the disease is still so high, especially in Sub-Saharan Africa. Where is the challenge in accessing medication for pneumonia?
Yeah, thank you very much. So with access, we'll talk about even delay. There could be delay of the mother seeking care. And this delay could be the mother is not able to recognize the signs. The signs we talked about, the lower chest wall indrawing. Sometimes the mother could think it's a abdominal problem. And in fact, in a study I did some time back, mothers were giving oral rehydration salt because they think it's an abdominal problem when they have lower chest wall indrawing. So, and when the child has got fast breathing or increased rate of breathing, the mothers may not recognize, and they are waiting. They are waiting to see how the child gets on. So you find there's delayed care seeking, and also sometimes in some communities, mothers are not empowered. So they have to wait for the husband, maybe who is in the urban area, to come and make a decision that the child has got to be taken to the hospital, or somebody else to make a decision. The other thing is when they come to us now as health workers, we may, depending on where one is, we may not give the correct treatment and maybe not the correct dose, but the government is really working very hard on that. So they have guidelines to guide on correct treatment.
Let's talk about the complications for pneumonia if undetected early, if not treated early. What are the possible complications for when a child is sick with pneumonia?
Pneumonia kills. And it's even as we talk, every 39 seconds, a baby somewhere in the world is dying. And pneumonia, if not treated, should be treated within 24 hours. And that's why when the mothers recognize the child has got increased rate of breathing, has got that lower chest wall indrawing, they should seek help immediately. Because if pneumonia is not treated, it kills within 72 hours, the bacterial pneumonia. Pneumonia has got complications. You can have chronic lung disease. A child can also have fluid in the lungs, can get pus in the lungs, and you could also get air in the wrong place within the lungs. And also associated with that, with the whole picture of pneumonia, is malnutrition, because at that time the child is not feeding, and most of the caregivers will not know how to do it. So the child loses weight, and that could be the beginning of the journey of severe acute malnutrition in that child.
Who is at a risk of developing complications once attacked by pneumonia?
Maybe before I answer that, let me say what causes pneumonia, then we can bring in the antibiotics. So pneumonia is caused, there are various agents. caused by viruses, caused by bacteria, and caused by fungus.
Yeah.
So the commonest cause of pneumonia in children is virus.
Okay.
In fact, in a study which was done in 7 countries, and Kenya was represented by Kilifi District Hospital, they found that among the under 5s, 61% of the under 5s who had pneumonia due to viruses. And 27% had pneumonia due to bacteria. And 2% had pneumonia due to TB. So what we are saying is that the pneumonia should be treated fast. With the antibiotics, we say that it should be treated, especially in the first 24 hours. So if there is delay, then a child may complicate and get severe pneumonia. And
do the symptoms show immediately?
Yeah, thank you. The chronic symptoms come later on, months and years. Yeah. Okay. But when a child has pneumonia, we'll start with cough or difficult breathing.
Okay.
And then usually they'll develop the milder form, and then which will progress to the severe form. So we'll first present with increased rate of breathing or lower chest for indrawing. If we do not intervene, we do not give antibiotics, then the child now can get a severe form of disease. And we mentioned that this time a child consciousness could be affected. Child is not alert. A child is not able to, might not be able to drink because of the severity of the disease. And you find that also the oxygen saturations, the lungs are not able to give adequate oxygen to the cells. A child will go to severe form of disease, and sometimes they may not make it.
So how do you differentiate between pneumonia and just a common cold, flu? Because sometimes it's hard to tell, especially during cold season.
Thank you.
Yeah.
So the 2 illnesses, they're going to present with cough or difficult breathing. The one which makes it very clear whether it's upper airway disease or lower, that is the lungs, in the lungs, is increased rate of breathing. And that is why it is very, very important, even for us health workers, to count that rate of breathing for a whole minute. We actually look and check and count for a whole minute, because when you find a child has got increased rate of breathing for her age or for his age, then that is pneumonia. Because of that 27%, and we don't have diagnostic tools to tell us whether it is virus or pneumonia, in low and middle income countries, we treat everybody who has the first breathing and the other signs of pneumonia, we treat everybody with antibiotics.
So is that a risk of developing complications?
Yeah, children. But it mainly depends on how fast the child is treated. Yeah. That's what I'm trying to come to. And the treatment for the one we are talking about here for the pneumonia caused by bacteria is antibiotics.
But it doesn't affect children only, right?
Yeah, no, it doesn't. It affects even adults, even old age, even the elderly. Yes.
What is the response gap? There is treatment for pneumonia, but still it's one of the leading killer diseases in the world.
Here we are talking of multisectorial approach. Looking at the risk factors for pneumonia, which are immunity, and we address issues of immunity in the young baby by exclusive breastfeeding. So babies who have had exclusive breastfeeding, they are at less risk of developing pneumonia. In fact, the exclusive breastfeeding reduces pneumonia by 50%. And exclusive breastfeeding reduces the risk of death from pneumonia by 15 times compared to the baby who is not breastfed. So if we're going to close that gap, we must think of supporting the mothers to be able to exclusively breastfeed. Also to prevent malnutrition by giving good complementary feeding. And this calls now for empowering people so that they're able to get good food. We also talk about reducing the other risk, which is indoor air pollution. How do we supply safer ways of the cooking fuel, so that we don't have people who are using wood, people who are using charcoal, who are using kerosene, because this causes indoor air pollution. And then now, because of, we said pneumonia is related to poverty, you find that people who are using that kind of fuel, some people are using cooking in the living room. And that now predisposes the baby also to higher risk. And remember, this baby is sometimes on the back of the mother who is cooking. So it gets a heavier dose of that indoor pollution. The other thing now to close that gap we need to think of is immunization. Pneumonia is a preventable disease. In fact, in Kenya, I'm very, very happy because we were the first country among the low-income countries to introduce the pneumococcal vaccine, the one which prevents pneumonia, that back in 2011. Our problem is the coverage is not 100% like for all other vaccines. So we need to work on that coverage. We have the vaccine, the government has given the vaccine, so we need now to encourage the mothers, and when they come to us, we check whether
it's a free vaccine?
It's a free vaccine.
Okay.
And this is a very expensive vaccine, but it's a free vaccine. So we need to close that gap of immunization so that we ensure that all children are vaccinated as per the immunization schedule given by the Kenya government. The other thing is also decreasing the risk of HIV, children transmission of HIV from mother to child. And that one we do it by early diagnosis or early screening for HIV in the mother and giving the treatment to the pregnant mother so that we reduce the risk. So you can actually see as a multi-sectoral approach and also empowerment of women. We mentioned about health-seeking behavior. So if women are empowered, and that's the girl education. If women are empowered, then they can make a decision. And they are able to make a decision that now I need to seek care, other than waiting for somebody, a third person, to make the decision. So you can see it's something which needs to be addressed by different sectors if you're going to achieve the SDG 3.
All right, we have to wrap it up. Thank you so much, Prof, for making time for us, and of course, as we create awareness about the pneumonia disease, and as we look forward to also celebrating the World Pneumonia Day, then we hope that your advice will be taken into consideration, the multi-sectoral approach into ending pneumonia in the country. Thank you once again, Prof. We do appreciate your time.
Thank you. Thank you for listening, and thank you for giving me a chance to talk about pneumonia.
Most welcome. That's all the time we had for our show this evening. Thank you so much for being part of our conversation this day. I'm Purity Museo. Do enjoy the rest of our programming. We'll see you again next week, same place, same time.